How is everybody today? Good. It's good to see you. Good morning. Thank you all for being here. I really appreciate it. Do we have any other elected officials here in the room that I can't see today? Okay. All right. Well, we're here this morning to talk about some very troubling facts about women's heart health in Nashville and a great new innovative partnership that is going to change everything as it relates to these numbers. So let me first give you some of the facts. Cardiovascular disease is the #1 killer of women in Davidson County. Heart disease and stroke kill more than 8 women for every 1 woman who dies from breast cancer. And there are way too many people who are at risk. 23% of adults smoke, 31% are obese, 26% are physically inactive, 33.6% report having high blood pressure, and 33.5% say they've been diagnosed with high cholesterol. So these are not good numbers, y'all. They're actually pretty scary. And we've got, however, a great team that is going to help us solve this problem. So today, I'm here and I am happy to announce the Cities and Communities with Heart Initiative Nashville, which is a collaborative multi-year effort to stop women in our city from needlessly suffering and then dying from cardiovascular disease. CCHI Nashville is the first of its kind to harness our city's diversity and energy so that we can dramatically reduce the impact of heart disease and stroke on women who live here in Nashville. We're going to have activities that are going to roll out throughout the year. I'm going to let others up here who are with me today talk about these details, and all of them will be introduced here in a second. But I'm very pleased to say that this initiative will touch women throughout Nashville from many different age groups, races, and nationalities. CCHI Nashville will be a partnership between my office, the Women's Heart Alliance, which is a national nonprofit organization that is dedicated exclusively to women's heart health, and also a partner with our Council on Gender Equity, Health, and Safety Subcommittee. Our partners also include our Public Health Department, the Meharry Vanderbilt Alliance, Nashville Health, which is former Senator Bill Frist's initiative to improve the health of Nashville and Davidson County citizens, St. Thomas Health, and more than a dozen other organizations. But these partnerships don't just stop with these groups. Faith communities and organizations in our community are also going to focus on heart health for women. So those of you in the media can help as well by helping to spread the good stories that we're going to talk about, and every citizen can get involved and raise awareness about this challenge and how we can overcome it. So I'm proud that Nashville is taking this very big step to improve women's health. I'm very grateful to the Women's Heart Alliance and our partners for all of the passion and expertise that they are going to bring. So I'm wearing red today in honor of this, and I now have the honor of also introducing British Robinson. She is the Chief Executive Officer of the Women's Health Alliance. She has spent her career focused on improving the health, the well-being, and the livelihood of women across the United States and the world, and we are so happy to have her here in Nashville. British, please come and have a few moments.
Thank you. Thank you, Mayor Barry.
Thank you so much.
Thank you, Mayor Barry, and thank you to your extraordinary team. It's been a pleasure and privilege to work with them over the last few months. And good morning, everyone. Thank you for joining us today and for welcoming the Women's Heart Alliance into your beautiful city. I'm thrilled to launch the Cities and Communities with Heart with Mayor Barry and our Nashville, more than 24 Nashville partners and collaborators. We created CCHI Nashville to improve the cardiovascular health of women in cities where the disease burden is high and where stakeholders are ready to take action. Cardiovascular disease kills nearly 400,000 women in the United States every year. That's more than all cancers combined. It's an epidemic, and we're here today to stop it in its tracks. It's hard to believe that our first trip to Nashville was 1 year ago this week. Wow. We came as strangers, but you welcomed us in. Thank you, Madam Mayor.
Thank you.
We couldn't be happier that Nashville is the first city in Cities with Communities with Heart. Nashville is a city committed to action, and it's a place where women are a driving force. The Women's Heart Alliance was founded in 2014 by Barbara Streisand and Ronald Perlman in hospitals Cedars-Sinai Medical Center and New York Presbyterian Weill Cornell Medical Center to prevent women from needlessly facing and dying of heart disease and stroke. In addition to my fantastic staff, I'm pleased to have with me today our medical advisor, Dr. Holly Anderson, our advisory board member, Dr. Rupa Balamursanian, and our VIP guest from the National Institutes of Health, Dr. Lenora Johnson. And last but not least, my dear friend, Dr. Bern Melnick, the Chief Wellness Officer and Dean at the Ohio State School of Nursing. A special thanks to Bern, to her and her team for providing technical assistance to a number of activities under the CCHI Nashville.
It sounded like an all-woman team.
Go women.
Saying.
You betcha.
Ron Perlman.
And Ron.
And Ron. 1 in 3 women in the U.S. will die of heart disease and stroke. That's nearly one woman nearly every 80 seconds. More than 22 women during this press conference. Astounding. We want to put an end to this epidemic, working at the national level and at the community level. We know when cities unite to take action, change can happen. And under CCHI Nashville, here's what we're going to do collectively with all of our local Nashville partners and collaborators, our national partners, what we're going to do right here in Nashville to reverse this epidemic. 1, launch Caring for the Caregiver, a program to improve cardiovascular health among nurses in Nashville's hospitals and health systems. 2, conduct a clinical study on pregnancy complications and their link to cardiovascular disease. 3, implement a workforce initiative through the Office of the Mayor to improve heart health of female municipal workers. 4, roll out a screening and prevention effort in collaboration with Tennessee State University focused on younger women. And 5, and we think especially important, is to co-create a community initiative centered around 1 or more community-based clinics and federally qualified health centers, reaching African American women, immigrant women, and refugee women. And we're just getting started. Come join us. Join our local partners, our national partners, and help us fight for hundreds of thousands of women right here in Nashville who make this city great every day. One day we won't have to fight, but until that day comes, we must not miss a beat in saving the lives of our daughters, mothers, sisters, neighbors, and friends. Speaking of being a strong advocate for daughters, neighbors, and friends and sisters, I'm proud to introduce a passionate advocate just like our co-founder, Barbara Streisand. She has been a spokesperson for the National Network to End Domestic Violence, and she's addressed sexism in country music head on. Today, she joins us in this fight around women's heart health. She is currently headlining a tour in partnership with CMT's Next Women of Country franchise and is a multiple ACM, CMA, award-winning artist, an amazing singer, a huge voice, and a mother. Please join me in welcoming Martina McBride. Martina, thank you for being our heart advocate. Welcome.
Thank you, British. I'm so happy to be here with you today and to work with you, Barbara, and the Women's Heart Alliance to ensure that women know their risk and how to prevent heart disease. This issue is close to my heart, no pun intended, because as a mother of 3 daughters, I believe that it's important to set a good example for them by taking care of my own health and teaching them how important it is as a woman to stay up to date with women's health issues. So you all heard the statistics that the mayor said on heart disease here in Nashville. They are startling. I was so surprised to hear this information. Heart disease is the #1 killer of women in this city, and it's time we did something to change that. As an entertainer and as a mom, I feel a responsibility to help shine a light where I can on issues that matter to all of us. It is really an issue about equality and having the same resources and education about women's heart disease as we have about men's heart disease. We don't know enough about women's heart disease, but we do know that it's underdiagnosed, under-researched, and whatever research there is underfunded. We do know that when it comes to heart disease and stroke, women and men are not the same. Women's hearts are smaller. Our risk factors can be different, our symptoms can be different, and our responses to therapies can be different. Because as women, we tend to take care of ourselves last, we are also less likely to go to the doctor if something doesn't feel quite right. And we are more likely than men to die following a heart attack. We have to reverse these trends. We must know more. Programs like the Cities and Communities with Heart Initiative, Nashville, are helping us create change at a community level and helping us better understand heart disease in women, both in Nashville and across the U.S. We have to end this epidemic for our moms, our sisters, our daughters, our friends, and all the women we love. We are so excited about the work to come and want to ask each of you to join us in this fight. Thank you so much for being here today. Thank you. And now I would like to introduce a key leader in Nashville who is helping us lead this fight, Karen Springer, CEO of St. Thomas Health.
Thank you so much. And as you've heard, this issue that we have has been brewing for a long time. We've known about heart disease in men and women for several years, but for some reason, we kind of lag behind for women. So we talked about this being a healthcare capital of the world, right? Nashville has got healthcare providers everywhere. So why is it that we're lagging behind with women's heart disease? One of the things that we were talking about in some initiatives are even our own caregivers. You know, many of our nurses and our workforce across the community here, we don't really take care of ourselves, even though we know better. And so we talked about how about if we started an initiative with nurses and student nurses and across all of the entities that we have in Nashville and see what are their barriers. They know what causes heart disease. They're among those who are providing the care for those who are having that disease. And so we talked about having this opportunity an initiative to help them to help themselves. Then we learn about those barriers, what keeps them from doing it. Everybody has busy lives. We have families. We have work schedules. For us in Nashville, some are driving quite distances.
Oh, come on. We're not talking about traffic today.
Sorry. But we have to live within that. This is the way we live. And so we have to live within that and still learn how to take care of ourselves. And so the idea is for us to launch an initiative, Nurses Week, where we will have welcoming nurses who want to participate in this and do a study around helping them to get better, help them to get healthier, and then to learn from that. And what are those barriers? Because their barriers are the same as women in our community. And so when we can learn from that, we can teach and educate our patients and persons in the community, how do you live with those barriers? So we at St. Thomas, as well as all of the other providers in the community, have committed that we will have a launching of this program for Nurses Week, where we'll do testing and screening, and then we'll put them into programs, whether it's at Vanderbilt, ourselves, or at HCA, to be able to put them into programs that can help them to better their lives. And then we'll learn from that and see what happens in the next 6 months. And then maybe we can change then some of the things that are going on in our communities, because it's barriers that are keeping women from taking care of themselves. And so we're very grateful for the partnership with the Women's Heart Alliance. We think this is a good launch that we should have been doing anyways. And so now we're excited about making that come true. And so with that, I'm going to go ahead and introduce Dr. Wilkinson, and she is the Executive Director of Meharry Vanderbilt Alliance.
First of all, I'm thrilled as a physician, researcher, and part of this community to be here to talk about this new initiative. When I think about the number of people in the room, the diverse groups that you've brought together to really focus on women's health, I think this is an opportune time for us to bring together and leverage the many resources we have here in our city to really address something that, as you've already heard, is really critical, and so far too little focus and too few resources have been put in place. As Executive Director of the Meharry Vanderbilt Alliance, I have the opportunity to work with researchers both here locally as well as around the country in thinking about how we can advance health and improve the lives of those that we serve. A critical issue for many of us is the gap and the disparities, both related to gender as well as racial and ethnic minorities. And I think this is an important opportunity for us to really leverage the resources that we've built here locally to focus on differences in biology, behavior, culture, and how we respond to treatments, prevention strategies, but also well-being in general. I also think that it's an important opportunity for us to bring this into the forefront of the academic medical centers in general, how we teach our students and train other health professionals to think about women's health, not just from a reproductive organ standpoint, but from the very differences that actually are impacting our lives the most. We need to make this critical as we deliver care. World-class care cannot be delivered the same if we're not really focusing on our differences and leveraging those differences to provide the best care and treatment. When I think about the resources that we already have in place, at Meharry, we have the Center for Women's Health Research, we have the HBCU Wellness Program at Vanderbilt, the Heart Institute, many programs in the School of Nursing and the Center for Medicine, Health, and Society. I can't think of a reason why we shouldn't be leveraging all of those resources and assets to really take advantage of this opportunity. And certainly, I can't end this without talking about the incredible strengths we have in the community. I remember a year ago when British, Nancy, and others came to Nashville talking about this new initiative and that Nashville was in the running. And of course, I thought, well, why not Nashville? What are you looking for? And they really talked about wanting to have a community with energy and partnerships in place. And I see colleagues in the room from the community health centers, community organizations who are focused on women's health. And really, these partnerships have been in place for many years. The opportunity to build on them, to leverage them, to improve the lives of women, couldn't be a better time to do it. So thank you all for being here. And I'm really looking forward to working on the steering committee as well as with the collaborators. So thank you.
Doctor, thank you.
And I will pass on to Caroline Young, who is the Executive Director of Nashville Health, to speak next.
Well, good morning. And I, too, remember a year ago sitting across the table from British and the team talking about Nashville and that we were in the running. And I said, well, you found the city. So I'm delighted how far we've come in a year. Nashville Health is proud to partner on this initiative. You know, we were launched on the premise of what you see happening here today and what's slated to happen throughout the program. Collaboration, convening, and taking action around some of our city's toughest health challenges. You know, it's really easy to be amazed by all the wonderful things happening in our city. It's an exciting time. Sustained economic growth, a new position on the map, so to speak. It's a great place for business convenings, personal travel, and increasingly a wonderful place to raise a family. But we are dealing with these tricky health challenges that are far from it status. And looking at the statistics from the front lines of care that we've talked about, we couldn't agree more. It's not okay for women who provide so much energy and leadership in the community, at home, in business, and in our families to suffer needlessly, to lose their health and their lives to this disease. Prevention is possible through awareness and collaborative action that you see here today. We can work together to ensure that our unique risk factors to populations, especially those at risk, are better managed. We can bring this message together to those who need it most. And I have a family member who comes to mind when I think about women's heart disease. But with statistics like this around the silent killer, I have to ask myself, who else? And do they know? So I hope that part of the message that you get here today, and as we continue with this initiative, is that you ask the same questions of yourself and of your loved ones, and you make sure that they're connected with resources they need to have improved health. So partnership, community, it's a critical step beginning here today, and we want to thank all of you all for joining us in this journey. And with that, I get the pleasure of handing the podium over to Dr. Bill Paul, Director of the Metro Health Department.
Good morning.
Good morning.
I'm Dr. Bill Paul. Probably the least expert in the room on the topic. I'm a doctor. I have one patient. My patient is Nashville. and our patient could be doing better. You heard from the mayor about cardiovascular disease in our community that's causing illness, it's causing disability, it's causing premature death, taking years away from our life and life away from our years. So so much of it's preventable too. And that's really what the business of public health is trying to prevent bad stuff from happening before it even hits us. Well, what kind of prescription do we need to write as a community to reduce the impact of heart disease for women? Well, I would say the first thing we need to do is we need to listen to Nashville's women and pay attention to what women are saying are barriers and opportunities for better heart health. So I could go on and on about my point of view on this, but I think it's really important that in crafting a response to heart disease in women that we are really tailoring it and listening. Some of the biggest prescriptions that we have for heart health generally are ones that hit us way before we're going to see a doctor. The mayor mentioned tobacco. Tobacco is still a huge cause of heart disease. How do we make it easier for our women and girls to stop smoking? Make it harder for our girls and boys to start smoking? Increase the number of smoke-free places throughout our community, homes and cars and other places like that. What are the barriers to physical activity? Physical activity, walking is like a wonder drug, 30 minutes a day. How do we make sure that every woman in every neighborhood and every girl has access to safe places to be physically active? Third, eating. We know about that we all should eat better, but what are the opportunities to make it easier and more possible in every neighborhood, every workplace, every place of worship to eat healthy food, more fresh fruits, more vegetables, less sugary soft drinks, and less unhealthy food? Well, health care is important. Blood pressure, cholesterol. These are all really important. So what are the barriers? How do we make sure that every woman has access to affordable health care? So our prescription is to create a culture of health, to create conditions in every neighborhood, every workplace, every school, every place of worship, to protect and improve the heart health for girls and women, and also for men and boys. Everybody knows that Nashville is Music City, right? You can't miss it. Music is woven into the fabric of the place. The airport, the streets, the schools, the Chamber of Commerce, tourism. It's part of the culture of this. It's intentional and it's inescapable. Well, Nashville is also known for its healthcare industry. How can we do the same thing for health? How can we make decisions all across our community to support a culture of health, to make good health, especially heart health for our women and girls, an inescapable and part of our identity as a community? I'm confident that we can do that. And I'm confident that we've already begun to do that. And I'm really happy that the Women's Heart Alliance has picked Nashville because we're on our road to becoming a culture of health, a culture of healthier hearts for our women and for our girls. This will add a lot of momentum where it's needed and accelerate our community's progress towards better health. Now I'm going to give it back to Mayor Berry, who has helped us already move towards a culture of health and really outlined a vision for a Nashville that is healthy for healthy people in healthy places and inclusive prosperity for everyone. So, Mayor Berry.
Thank you. Thank you, Dr. Paul. And thanks again. I just wanted to take a quick moment and just make sure that I personally thank all the folks who are up here on the stage. So, Caroline, Martina, Consuela, British, Karen, amazing what all of these folks can do together. And that's always been the charge. Government cannot solve every problem, but communities can. And this is a community of doers. Action. What you heard today were people saying, we're actually going to move to action. And that is always, to me, the most exciting part. The most exciting part is that we get to be first, yes, Nashville, but that we actually get to improve the life and the health outcomes for women in our community. So we really appreciate all of you being here. Dr. Paul and everyone, thank you for speaking. We're going to step away from the podium. If you all want to have questions, we'll come down and talk. But thank you so much. Thank you, guys.